Hello, good morning. Coming to you live on a cold, chilly morning in December in Michigan. So I thought today's topic was really appropriate. We're going to talk about lymph and sinus drain. As I know, a lot of my patients have been suffering with some congestions and some colds lately. I thought this would be a great day to teach you how to do your own self lymphatic drain. So coming to you really raw hair, face all washed, no makeup on. Well, that's how we're going to want to start. Okay. Men too. No makeup. Make sure we pull our hair back away from our face. Remove all of our earrings and such. It's really important to do a lymph drain on yourself and to get in and sort of mechanically work on your own lymphatic system. Today, we're going to do some lymph flushing as well as sinus pressure points so that you can mechanically remove some of that fluid that may be retained in the sinus cavities themselves. Sometimes it's not so much a problem of the infection as much as it is the fact that some of your own fluids have stayed stagnant in your sinuses because you've been traveling, you haven't been exercising, you haven't been doing self work on your lymphatic system. So that fluid can just sit in these cavities and become stagnant, which is just a breeding ground for bacteria. So let's make sure that doesn't happen. So we're going to start today by just working on some lymph drain. I'm going to talk to you about why we're doing this while we're doing it. I'm just got my fingers crossed over and I'm very gently with very even strokes working down the sides of my neck. Whenever you're on your neck, you want to make sure that you're going very gently on both sides, or you just do one side at a time. When we work on lymph drain, we can either use the tips of our fingers or the inside of our pinky line, or we can do our flutter. We just want to be careful that we don't put too much pressure on our neck when we do it at the same time. So by working on opening up the lymphatic system with mechanical movement, we're going to be increasing the blood flow and the circulation to that area, which is going to stimulate the drainage. The drainage is going to stop from the top of the head and work its way down through all of the sinuses on the face and the preauricular sinuses, the postauricular sinuses, the submandibular tonsils, submandibular sinuses by your tonsils down into your cervical lymph chain. Down here, we move into our supraclavicular lymph nodes, and it's going to be removed from the lymphatic system via by the aortic arch. It's going to enter to the circulatory system and be removed from your body. Okay, so let's just start with a nice gentle pull across the upper forehead. We're going to focus on even strokes, relaxed face, not too much pressure. 3 to 5 times. Now 3 to 5 times along the arch of your eyebrow. Nice and gentle, right underneath your eyebrow. Just a nice gentle pull. And 3 to 5 times underneath your eyes in an upwards motion. When we're working underneath our eyes, make sure that we're always going very gentle. This is also why we want to make sure we have a nice layer of that serum or that oil on our face. You're actually massaging it into the pores of the skin by doing this. And as you can see with my Irish skin, giving you that nice, quick, pink, blushy look. Okay, and then right across the jawline in an upward motion. Up, because we're going to be moving it out by the ears and then from the ear downwards, just downwards. So we're just getting whatever's in the channel sort of open right now. Once I've done a little lymph drain, this is sometimes when I like to consider doing any kind of drainage. So you can see I just got a little drainage down my throat. So this is a really good time to gargle with some salt water, maybe to slush some apple cider vinegar around quickly, not leaving it on the surface of your teeth for very long and getting that down. If you like to do nose drainages by inhaling salt water or apple cider vinegar, this is a good time to do so, so that you can get some water circulating into your lymph system. Okay, now we're moving on to sinus drainage. I'm going to take my 2 peace fingers And I'm going to actually prop my elbows here. And I'm going to start right up underneath my eyebrow. Okay. By propping my elbows, it releases some tension that I might be feeling behind my neck. So we're just going to prop right here. And I'm almost just letting my face rest into these with the point of contact being right at the tip of my fingertip. So not really a flat pad, but a really particular point at the top of your finger. When you really come in here with the top of your finger, you're going to maybe feel a little nodule. Most people are going to have the sinus drainage point from the frontal bone somewhere around the first third of their eyebrow. So from my fingers inwards. So mine is right here, and I can feel that little nodule. If you find your nodule, you can just kind of keep your pressure right on it, pulling in an upwards motion. And usually you can start to feel that sort of pulling and draining. I'm just going to go nice and gentle outwards and down. The face sinuses are going to drain right here in front of your ear. So it's up and out. And hold nice and pressure. Try to imagine what the fluid in a tube of toothpaste is like. It's kind of boggy. It doesn't have a whole lot of, it's not really in an aqueous solution. So it needs some pressure to be able to move that toothpaste around in the tube, but not too much that you're actually going to be indenting on your skin. So just kind of up, hold, and then move that fluid out. Just be intuitive with your strokes. You might have seen me just switch from going under my eyebrow to over my eyebrow, but you can sometimes become very aware of where you've moved that fluid. And you're just going to try to move it out of your face. All of this mechanical work is also going to help your skin tremendously by making sure you're getting blood flow into these areas that where our wrinkle lines tend to form. Okay, so our next one we're going to find is in our maxillary bone, which is our cheekbone. So we're going to come down. I usually use my middle finger for this. You're going to come down off of your eye orbit, and right at the bottom of your eye orbit, right around here, you're going to find a little nodule. Again, my elbows are rested and I'm just sort of resting my head into my fingers. I'm going to switch to my index finger. Today, it seems to be that I can find it better with my index finger. I know it kind of makes you look funny. Naturally makes me want to open my nares and get that nasal breath flowing. Let's take a couple deep breaths here through the nose and out the mouth. And out the mouth. And then really gentle, nice gentle strokes. We're going to go out towards our ears. When you have a cold, usually you're going to notice you're going to get real rosy through your cheeks by doing this, which is a good sign that you're getting blood circulation and clearing out some of the gunk. Okay, now that we've moved the fluid out of this zone, our top zone, let's go over to our pre-auricular sinus. That's pretty easy to remember because this is your auricle, your ear, and pre would be in front of it. So we're going to do one side at a time. And as you kind of pull down here, you might notice that you can find a couple little areas that feel like pea pads, like little peas under there. And as you move that, you can just kind of feel the pressure. This is real obvious on toddlers. If you come up to your toddler, you might notice that they feel like they've got a little pea right there. And you just kind of move that down. Now that I'm moving it down right in front of my ear, right into this top nodule under my mastoid process on my neck. Here I have a lot of bogginess from everything I've moved out of my face so far. I'm going to move to the other side of my body. And you should be able to feel that you've actually created a little fluid buildup right here in your neck. Draining it down. Just so that when I do my next stroke, I have some room to move it. Okay. Okay. So now we're going to go on your frenulum right here. And you're just going to pull down 1, 2, 3, 4, and a little bit out to the side. 3, 4, 5. And when we're down, 1, 2, 3, 4, 5. And now to your side. You'll notice it's very relaxing to actually make contact with your own face. We tend to not want to touch our own face very often. And it releases so much stress and tension that we keep in the muscles as well in our face. Now to the side we go, very gentle up towards that preauricular. Any kind of organic movement that seems to feel right to you. And again, sweeping them down, 2, 3, right to that first cervical lymph node. Okay. And now the ones underneath our lips, we're just going to move in an outwards motion and up, seeing that we're getting a lot of good blood flow to those cheeks, really starting to look awake and up towards our ears. Okay. And now one last sweep down our ears. Okay. Now we're to our first cervical lymph node, which is right in front of the ear. Right now, I just want you to pressure on that so you can find it and feel that bogginess. You're not going to be digging in too far to your neck. Just feel that there's a tube of toothpaste on the outside of your muscles right there. And just give it a little pressure. Maybe take a deep breath through your nose. You want to make sure we can create some room. And the other side. When we're really working, not just doing a nice gentle lymphatic chain, but when we're drain, but when we're really working into the lymphatic chain, we want to make sure that we only do one side at a time at this point, because too much pressure can put too much stimulus to the carotid sinus that is embedded in underneath the platysma muscles in this part of your neck. Okay, so we're creating a little room. Now we're going to give ourselves a little stimulus of all of the sinuses around our ears. So I'm taking the top part of my ear and I'm just gently pulling up. The nice firm amount of pressure, I'm grabbing the back of the ear and the front of the ear and pulling in an upwards motion just to create a little traction, especially if you have fluid that's built up in the ear. And now with my thumbs, I'm working on my actual head. Behind my ear are the postauricular sinuses. And I'm just kind of going to pull that down to see if there's any bogginess. And there sure is on this side today. Not too much on this side. It's different every single day, depending on what our body has been exposed to in the last 24, 48 hours. Good, kind of pulling it down. I'm just going to pull my ears out a little bit, also stimulating all these wonderful acupressure points and pulling down gently on my lobes using fingers like this. Just kind of pulling and massaging in a downward motion at this point. And now we're back to the cervical lymph chain. Now you can probably see even on me that I'm starting to get a little red through here because you're getting a lot of blood flow. So we're going to pull down that lymph chain. And let me show you where your lymph chain lies. This is your SCM muscle. And as I push my head against my hand, you can see that muscle jump right out on you, right? You see it? It's like just like a rope right down from your sternum and your clavicle to your mastoid process. That's why we call it the SCM, sternocleidomastoid. So we're just pushing against here. And if you can find that SCM, the lymph chain lies right on top of it. So I've got my SCM in my fingers like this, and I'm just massaging. I can let go here because I know where it is, but if this helps you find it, and see, I've just got my hand on both sides of it, being very gentle in this area, so you're not choking on yourself, down to that supraclavicular lymph node, okay? And now to find it on the other side, I'm going to grab on behind my ear, one finger in front, one finger behind the muscle. And just massaging down. A lot of times you can get a little postnasal drip as you're moving this fluid out of the lymph chain and down into the supraclavicular lymph nodes. Okay. Okay. So now we're just going to finish with another just little gentle lymph drain. 1, 2, 3. And close my eyes here and take a deep breath through my nose. As I'm stimulating this area, I'm getting a lot of mental stimulation to the pineal gland as well. So I'm going to set a little intention for grace and peace for our world today. And moving down to the maxillary area, nice and gentle, like we talk about under the eyes, and a little bit in an upwards motion to the ears, getting whatever fluid we might have left in there, and then nice and gentle down. And now you should feel really nice and stimulated, it's a great time to take a nice big glass of water. Lemon water can be very detoxifying, or if you're not feeling so great, maybe a little tea, and a little doing saltwater drain will help as well. Thank you for joining me today.